Thank you. Good morning, ladies and gentlemen. Mangwanani. All protocol observed. The ICPD program of action has transformed the way in which the linkages between population, poverty reduction, and sustainable development are addressed in Zimbabwe by putting the rights, needs, and aspirations of individual human beings at the center of sustainable development. May I highlight to you that the Zimbabwe National Family Planning Council, ZNFPC, is an agency coordinating and giving technical leadership in the provision of quality integrated family planning and sexual reproductive health services. It also plays the secretarial role in the Zimbabwe National ICPD Task Force, which is responsible for monitoring the implementation of ICPD 25 commitments. The organization has made strides to achieve the ICPD 25 commitments, which focus on zero unmet need for family planning, zero preventable maternal deaths, and zero gender-based violence. The country has made achievements in the provision of quality integrated family planning services to the extent that, one, the contraceptive prevalence rate increased from 59% in 2010-2011 to 68% in 2022, one of the highest CPR in the region. On the other hand, whilst the contraceptive prevalence rate increased, it should be noted that the unmet need for family planning declined from 13% to 10% in the past decade, against a target of 6.5 by 2026. The National Family Planning Strategy 2022-2026 and its costed implementation plan were launched and disseminated to guide the nation in family planning programming. While keeping focus on family planning issues among women and girls, the 2022 to 2026 family planning strategy has also taken on board the importance of male involvement in family planning at family, community, and programming levels. In this strategy, may I highlight that men are not regarded as perpetrators of the myriad of reproductive health problems affecting women and girls, but as individuals with their own specific reproductive health issues, which include prostate cancer, sexually transmitted infections, including HIV and AIDS, and male infertility. And these reproductive health issues among men need due attention. In addition, given the patriarchal nature of our Zimbabwean society, the strategy took into cognizance the fact that without male involvement, the achievement of ICPD program of action and the Nairobi commitments could be a mammoth task, a recommendation which we also want to put across this South-South triangular cooperation. Zimbabwe signed the Family Planning 2030 commitments and the Compact of Commitment, which has resulted in an increase in domestic funding for family planning from the national budget of 1.7% in 2013 to 2.4% in 2022. The national budget has been allocated 14.9% of the total national budget. The national health budget has been allocated 14.9% of the total national budget in 2022, showing the government's commitment towards meeting the Abuja Declaration. The Zimbabwe Assisted Pool System, commonly known as ZAPS, a commodity supply chain system which was implemented in 2017, has increased the efficiency of ordering and stock control of medicines and commodities that has enhanced the distribution of family planning commodities from warehouses to the community level, distribution to rural health facilities, and also the community-based distributors. The establishment of the Family Planning Service Delivery Guidelines for all family planning implementing partners is a key achievement in guiding all the implementers in service provision. The Standard National Adolescent Sexual and Reproductive Health Training Manual for service providers was also developed, and continuous capacity building of health workers, including peer educators in friendly service provision, is being conducted. There has been continuous training of private and public sector service providers in the provision of long-acting reversible contraceptives. The community-based distribution program, which remains a pillar in family planning service provision at community level, has yielded positive results in reaching out to hard-to-reach areas and also to vulnerable groups. In 2020, we launched the one-stop shop project in all static clinics for integrating HIV and family planning services, and this approach has increased service uptake. Notwithstanding our achievements, the country is not on the exception to the global challenges affecting each one of us here. The country is experiencing skills gap due to high staff attrition, and programmatically, it is still a challenge to achieve the last mile due to limited resources. Lastly, I'd like to thank the PPD through its South-South Triangular Cooperation, given that as a country, we have realized a lot of positive results from skills exchange program. Our programmatic indicators reflect the commitment by the government through its agencies at NFPC in achieving the ICPD commitments and sustainable development goals. Thank you.